with our host, Tom Quigley from ClaimLinx. Tom, what's going on?
Another day in paradise.
Yes. Last topic where I'm going to cover with you is why your health plan gets more expensive even when no one uses it. Many employers assume healthcare costs employers are using the plan too much. But every year companies see 8 to 12% increases even when claims were low. Employees barely use the plan. No major surgeries occurred. So the real question becomes, if utilization didn't increase, why did the price? Tom, why do healthcare premiums rise even in low claims years?
Because the insurance companies have the system in their favor. They raise rates based on trend. This is what the average, you get a year older, so your risks are higher. All these buzzwords, and I sit there and I go, yeah, well, makes a lot of sense, guys. Wow.
But you do exact opposite at ClaimLinx.
Yeah, I work on what I save. So yeah, I show them how to buy this stuff intelligently and not allow one or two people who have health conditions to cost the whole group thousands extra, and you still take care of everyone the same way. So there's no discrimination. Very simple. It's not hard.
What role does medical trend play in health plan pricing?
That's how they get around getting the departments of insurance for groups under 50 to raise rates and individual plans. They make it sound like, oh man, the risk is just so bad. And then on all, they just try to do trend. It's all game. Even on these level funded health plans and these self-funded, they're comparing it to the market, knowing that, hey, if we raise our rates 20%, we're still going to be the best. It's the way it is.
Okay. How do insurance risk pools affect employer pricing?
The risk pools on the smaller, again, they have to get permission from the Department of Insurance and the individual market from both the Department of Insurance and the federal. The feds on raising rates about 9.9% because the Affordable Care Act. So what happens is, they just get the risk pools, and then you got the risk pools for what they call them consortiums, trusts, all these others, and they make no sense. There's one in New Hampshire for the school districts and towns, and I laugh because they literally could go directly to the insurance carrier and pay half the cost for the same plans they're buying through the trust.
Interesting. Why are specialty drugs driving so much of the cost increase?
Drugs that's a whole separate issue with the patents and all that. But almost every major drug has a coupon that will pay for your whole deductible if you set your plan up correctly. The insurance carriers the generic drugs show you that renewal on groups that they underwrite, because that's how they find out if you have more blood pressure, cholesterol, diabetes, all those issues. Through the generic drug costs $2, but the risk now is so much diabetic. And you sit there and you're like, really? It costs you $2 and you don't even pay anything because the employee pays the $2. So you guys don't pay a dime, but yet you're going to jack the whole group up 8% because of the new diabetic on your group of 10 and you have a level funded health plan. So it's a huge mistake for the employers to show their drug coverage to the insurance carriers. Huge. You don't have to. There's other ways.
Are hospital systems mergers increasing healthcare prices?
Yes, because there's fewer and fewer of them. So they have more bargaining power against the carriers then they threaten to cancel them. And then you have all these people running around crying in the streets that Anthem Blue Cross isn't going to negotiate with XYZ hospital.
What can employers actually control when it comes to healthcare costs?
They have to buy it differently, and they can control the costs by setting up their plans correctly, how they purchase the catastrophic coverage, period. That's where they're making their biggest mistakes.
And why do people, this again is a no-brainer. We've done over, I don't know how many podcasts, Tom, in the last year. Do you feel that there is a specific, I just want to know, this is a no-brainer. Why is no one else doing what you do?
Because I'm doing the opposite of how they've been trained. They've been doing it for 25 years. They are trying to change by these individual coverage health reimbursement arrangements, but they were where we were 25 years ago. They don't even understand what they're selling. And the problem is they make zero sense with the way we do our medical expense plans, because individual purchase isn't cheaper the way we do it. There's other options that are much cheaper and a better, more easier administrative wise too. So the problem is they all are running and they're trying to charge these ridiculous fees to make up for their lost commissions.
Oh, really? Okay. So they're trying.
I'm like, why are you giving them fees? What are they doing?
All right. We appreciate it, Tom. Go again to ClaimLinx to schedule a call with Tom today. And we appreciate it, Tom. And we look forward to chatting with you. All right. That was a special simulcast of the Neil Haley Show and the Cutting Edge Benefits Podcast. Take care.